I've been around since the early 90s in the cosmetic world, and I've seen all sorts of things come and go. I was one of the first people to have lasers in the country. I worked when nobody was doing sclerotherapy. I introduced laser hair removal, arguably, you know, so I've seen a lot. And absolutely no doubt that there's a tremendous psychological boost given to people by improving their looks, and you know, we're dealing with aging changes most of the time, and people don't like the idea of getting old, and they do get tremendous boosts from it. The other side is that there are some people who probably overdo it, you know, the so-called cosmetic addicts. But generally speaking, most people get a lot of benefit. There are some people who, you know, we have to identify who probably shouldn't be treated at all, and you can actually make them worse. It takes quite a bit of skill to spot those. The industry has seen an awful lot of changes. A lot of new treatments have come in. These treatments are advertised to the public, and the public, of course, always want new treatments. They want less invasive treatments, and the industry tries to provide these, but the fact is some of them don't work very well and aren't effective and aren't suitable for a lot of people, and it's really hard for the consumer to decide what's the good treatment and what's the bad treatment. If the client comes to me and I really don't think that what they're asking for is the best thing for them, I will tell them so. You know, I have absolutely no qualms about that. I send a fair proportion of people away. Sometimes they have a treatment in mind, but it's just not the best thing for them. And I think most reputable practitioners would admit to sending quite a large proportion of people away for that reason. A lot of people do shop around. They look on the internet. They often know the right questions to ask because they read what questions to ask the practitioner. But it is very difficult for them. They might look to see what professional organisation somebody's in. They might have seen these people in advertisements. But at the end of the day, I think most people make their mind up by how they feel about a particular practitioner, whether they feel comfortable with them, whether they think they're being honest with them, whether they feel they're being sold something, and I try to be honest with people. I try not to treat people if I don't think it's appropriate, and I never try and sell things to people.
A lot of things bothered me now, but I would like to have advice from you. What do you see from my face?
Okay.
What needs to be done to improve appearance of my face?
I'd rather do it the other way round, that you tell me what you see when you look in the mirror that you don't like. The advantage of that is that we concentrate on what really concerns you, not what necessarily I see. It's more important that we concentrate on what you see. Most of the treatments we offer tend to be quite polarised. They'll either be the short walk-in, walk-out treatments, or the more invasive treatments. And most people will come in with a clear idea of which they want and don't want. And over the years, treatments have become less invasive. Most people want the less invasive, more walk-in, walk-out treatments. And things that are eternally popular are things like botulinum toxin and fillers. And these have maintained their popularity, partly because they're simple walk-in, walk-out treatments without a lot of side effects and downtime, and partly because they're good. Like I said before, the treatments that are not good tend to fall by the wayside.
The best person to see when it comes to consulting with your skin would be Dr. Martin. Taking into consideration he uses a very soft touch technique as well as a very impartial or non-invasive sort of method that he would use so that it's not aggressive on the skin and makes you also look rather natural. So he would be the best person to analyze your skin and assess from there.
Every time I've come, I've got the effect that I've been looking for. I've never had any side effects. I've always been told how to, you know, look after myself after the treatment, what to expect, what to do, what not to do. So I feel very trusting that I'm going to get what I'm looking for, and that's why I keep coming back.